Yeah.
Good evening, everyone. On behalf of Dr. Agarwal's Institute of Optometry, I extend a warm welcome to each and every one of you for the 17th episode of Optometry series. The topic for today is public eye health and optometry. So I'm very happy to welcome my fellow teammates, Ms. Meenakshi and Ms. Anshika, ma'am. Hi, ma'am.
Hi.
Yes, ma'am. So you are the right person to introduce the today's moderator, ma'am. So why today's topic and why the moderator?
Okay, so you want me to introduce him?
Yes, ma'am.
Okay, so I'll be very, very glad to introduce Ragukumar. He's my own student from SRM University when I was teaching there. But right now he's currently working at LV Prasad Eye Institute after he's completed his MPH. And he's into public health, and he's very passionate about working and looking for in communities. And as a public health researcher, he has worked and has a lot of impact on the overall health and well-being of people. He's done groundbreaking research on the social determinants of eye health and epidemiology of eye diseases, effectiveness of various interventions in improving eye conditions. He's had almost 6 publications to his name, and not only in doing public health and optometry, he's also had the skills in statistics, research. He is very well versed in SPSS, Strata, and Excel. And I'm really proud to have him here as a moderator for our session, where he can give us insights on how public health can also be a specialty, a field which optometrists can take up.
Thank you, ma'am. We can very well see the proudness in your face. Actually, you're all smiling and smiling. So let's get into the formal introduction for the speaker. For the moderator today, I request Ms. Harni to speak about the moderator. Hi, Harni. Yes, Harni, you can start.
Hi, ma'am.
Yes, you can start to speak about the moderator.
Good evening, everyone. I'm K. Harini from C18. Welcome to the 17th episode of our optometry series. Today, we have a distinguished guest who has decided his career to improving the health and well-being of individuals and communities through evidence-based interventions. I'm very happy to introduce Mr. Ragukumar Venugopal, a clinical optometrist and public health researcher hailing from the India Health Outcomes Public Health and Economic Research Center or at LV Prasad Eye Institute. Mr. Rahukumar's passion lies in the intersection between eye health and overall health. With years of experience in the field, he has delved deep into the complexities of this area, addressing the challenges that arise. As a public health researcher, he has made significant contributions focusing on eye health and its profound impact on overall well-being. His groundbreaking research spans the social determinants of eye health, the epidemiology of eye diseases, and the effectiveness of various interventions. His work has not only been published in top-tier journals but has also been widely recognized by fellow researchers in the field. Mr. Rahukumar brings a wealth of skills, including expertise in public health research and applied statistics. Currently, he is engaged in a fascinating project analyzing a staggering 9.1 million patient consults from the iSmart EMR database when he is uncovering new insights into ophthalmology. Mr. Rahukumar Venugopal, thanks for accepting our invite to moderate today's session. The speaker for today is Ms. Gopika, studying third year at Dr. Agarwal's Institute of Optometry. I request Ms. Gopika to start the presentation.
Good afternoon, everyone, and I'm Gopika from third year. I'm going to start my presentation. Topic for today is public health in optometry. Public health. WHO defines public health as the art and science of preventing disease, prolonging life, and promoting health by the organized efforts of the society. WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And how does it work? It defines the problem, it identifies the risk and protective factors, it develops and tests prevention strategies, and assures widespread adoption. And these are the determinants of the health. And the biological thing says about the genetic makeup, and it is permanent and it cannot be altered. And it transmitted by the hereditary, and no treatment is there for this biological. And environment. Environmental is the internal environmental and external environment. In internal environment, it comes with microorganisms, and external is with macroorganisms. It is of three types: physical, biological, and social. In physical, air, water, and soil. In biological, it is plants, animals, and microbes. In social, it is culture, beliefs, and tradition. In behavioral and socio-cultural, it depends on economic status, cultural values, social values, personal habits, and behavioral patterns. Under socio-economic, it is determined by income and indirectly by the religion and the caste. Health services. In this term, health and family welfare services cover a wide spectrum of personal and community services of treatment of disease, prevention of illness, and promotion of health. And the sixth one is the aging of population. By the year 2020, the world will have more than 1 billion people aged 60 and over, and more than two-thirds of them living in developing countries. Under gender, the 1990s have witnessed an increased concentration of women issues. In 1993, Global Commission on Women's Health was established. Under this, agenda for action will be on women's health. And the last one will be the other factors. We are witnessing the transition from post-industries age to an information age, and experiencing the early days of two interconnected revolution. Development of these technology offers wide opportunities in providing an easy and instant access to medical info. Public health optometry. Public health optometry is a hybrid discipline that combines the principle of public health and optometry. An optometrist applies the principles of both these specialties to reach out to the communities to provide care, promote eye health, and train community level and eye care workers. Visual problems in India. Asia has the world's largest number of blind people, among which 42 million people who are blind, and the 217 million are visually impaired globally, more than 60 in Asia. Although screening, outreach, and eye care programs are increasingly widespread in Asia, many of the visually impaired people remain undiagnosed, untreated, or suboptimally managed. And these are the major causes of visual problems in India. The undercorrected refraction will be the leading cause of avoidable visual impairment. And role of an optometrist in public health. Service to home, patient care, promote eye health, prevent diseases, managing avoidable blindness, educate the community regarding visual and ocular problems, epidemiologic research on various issues, collaborating with government and non-government agencies. And the levels of screening are the mass screening, high-risk screening, multi-phase screening, multi-purpose screening, and opportunistic screening. Under mass screening a mass people, example for the school screening camps, which are done for refractive errors, and high risk. People at high risk will be screened. Example, the maternal and paternal things. Example, if the parent has glaucoma, the child will be tested glaucoma if needed. Multi-phase will be screening people with disease with multiple approach. Multi-purpose is example, diabetic mellitus and hypertension will cause some sort of infections in the eye. And opportunistic will be the sanitization. Levels of prevention. Prevention can be achieved in terms of 4 levels. primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Primordial prevention will be the refractive errors. Under primary prevention, there will be no disease, but refractive error will be found. And in secondary prevention, disease will be present, and to prevent them, and they'll be prevented from their complications. Under tertiary, complications will be there. To prevent disability, this tertiary prevention is being applied. Levels of higher health care pattern. Healthcare is a multitude of services rendered to individual families or communities by the agent of health services or professions for the purpose of promoting, maintaining, monitoring, or restoring health. The healthcare goal of system is health development, that is, a process of continuous and progress improvement of health status of a population. To achieve this goal, healthcare services are usually organized at three levels: primary healthcare, secondary healthcare, and tertiary healthcare. And levels of healthcare: primary healthcare is provided at the community level, and secondary healthcare is provided at PHC, CHC, and DH, etc. Under tertiary healthcare, provided at hospitals. Primary healthcare. It is the first level of contact of individual, the family, and community with national health system where primary healthcare is provided. A level of healthcare, it is close to the people where most of the health problem can be dealt with and resolved. The measures of health promotion and prevention are taken a maximum effort at this level of healthcare. Peoples are made self-reliant. Besides providing primary health care, the villages health team bridge the cultural and community gap between rural people and organized health sector. Secondary health care. The next higher level of care is the secondary health care level. At this level, more complex problems are dealt with. Care is generally provided in district hospital and community centers, which also serves as the first referral level. Curative services are provided at this level. Tertiary healthcare. The tertiary level is more specialized specific facilities and attention of highly specialized health workers. This care is provided by the regional or central level of institution. Example, medical college hospitals, all Indian institutes, regional hospitals, specialized hospitals, and other apex institutions. And this is the service delivery model. Under this, first thing will be the service. For the service, they will be having partners of government and non-government. Under activities, we'll be educating the people. Under resources, we'll be giving spectacles and will be providing the needed things at low cost. Under cost, it should be affordable for the peoples to buy it. For the customers, we should spend quality time and we should explain about the condition and we should tell them how to overcome from that. And under channel, it can be physical and also virtual thing. Under revenues, it is not expected. For the customer thing, for pediatric and geriatric, it will be different ways. Programs. NPCB, National Program for Control of Blindness. India was the first country in the world to launch national level blindness control program. It was renamed as National Program for Control of Blindness and Visual Impairment, and it is implemented all over the country uniformly with the goal of reducing the prevalence of avoidable blindness to 0.25% by the year 2025. Current status as per the survey carried out during 2015 to 19, which showed reduction in the prevalence of blindness from 1% to 0.36%. And these are the activities of NPCB. They do cataract operations. They involve NGOs, civil works, commodity assistant, IEC activities, management information system, monitoring and evaluation, school eye screening program, collection and utilization of donated eyes, control of vitamin A deficiency. And this is the official page of NPCB. Vision 2020. The Right to Sight is the global initiative for the elimination of avoidable blindness, a joint program of the World Health Organization and the International Agency for the Prevention of Blindness. It was launched in 1999 to promote a world in which nobody is needlessly visually impaired, where these with unavoidable vision loss can achieve their full potential. Currently, results suggest eye care services contribute to the observed reduction of age standardized rates of avoidable blindness, but target in an aging global population was not reached. And teleoptometry and its application. Teleoptometry is virtual eye exams through live video conferencing technology rather than in person. Patients will schedule an appointment online. Smartphone, tablet, or computer to access can help the live video conference. Digital technologies enables them to perform needed comprehensive eye exams remotely, similar to an in-office test but with added convenience. The main disadvantage of teleoptometry is the eye exams are less detailed than in office exams. Applications of teleoptometry. Both clinical and educational advantages are seen. Clinically, screening of the disease, diagnosis and clinical management plan, secondary advice and support in clinical management, peer supervision and support. Educational, professional development through group discussions, lectures and tutorials, research and administration activities. Information, education, and communication for eye care programs. Information, education, and communication in primary health care and eye care are relevant to nearly all the direct and indirect causes of childhood blindness. Applications, health promoting lifestyle and practices, proper use of health services available to stimulate individual and community self reliance and participation to achieve health development through individual and community involvement at every step from identifying problems to solve them. Also, to know governments and non governmental agencies to prevent unnecessary blindness. Information. This consists of providing scientific knowledge to the people about the health problems and how to prevent them and promote and maintain health. Education. It is a process which aimed at encouraging people to be healthy, to educate how to stay healthy, to be independent, and to seek help when needed. Communication. To communicate and address the issue is to seek help or collaborations with government and non-governmental agencies to prevent unnecessary blindness. And these are my references. Thank you.
Thank you so much, Gopika. That was a wonderful presentation. Now request our moderator, Mr. Ragukumar, to share his valuable points. Hi, Raghu.
Hi, Gomati. Thank you. So before commenting on my presentation, I would thank so much for your warm welcome. And I'm honored to be a moderator for this session. I thank my Anshi ma'am, who is my faculty, as she mentioned, and she was my one of the first project guide during my undergraduation. And also I thank Dr. Agarwal Institute of Optometry for this opportunity. So going to the presentation, it was a well-structured presentation given by Gopika. So she have presented very nicely about the dissection in public health and the role of optometry in community eye care. I would like to add few points in some area as she had mentioned. So the most commonly, first of all, I like to mention on the screening. So the most commonly used method of screening were three among them. One is the mass screening, the next is the iris screening, and the opportunistic screening. So for the easy understanding, mass screening, as the name suggests that it is a mass. So you will do or examine for the whole population. So for example, you will do a screening for the entire rural population of Salem district to pull out the refractive error prevalence. So this is what you will do for the mass screening. And the next one is the important thing is target or high risk screening. So this method is more effective and it includes only individuals who are at risk. As she mentioned, for example, in this case, we will screen our factory workers for the presence of glaucoma. So this procedure can be applied to the relatives of glaucoma patients in their family. So this is like something to pull out the higher likelihood ratio of finding of this disease by this method. So the next one is the opportunistic screening. So the people will undergo for an examination of what they haven't complained for. For an example, a elderly patient will visit primary healthcare centers or the community level centers for a diabetes or hypertension or coronary artery disease. But we will examine them for to get any chance to predict any chance of diabetic retinopathy or hypertensive retinopathy. This is also called as case finding scenario. And the monophasic screening is something like only one disease condition is ruled out at that time, and the multiphasic condition is more than one disease condition were screened at the same time. So these are the what is the difference between the screening technique. And the one more area where she had mentioned very nicely is the level of prevention. So I haven't prepared any presentation due to a tight call. So just imagine you are seeing a pyramid. I'm just saying how this prevention or how this level of care is distributed among government sector and the public or the private or the NGO sector. So initially we will see the for the government sector. So imagine a pyramid, and the pyramid is divided into 4 boxes. So the ground level will be community level centers, which is like health, which includes health sub-center, primary centers, and the updated primary centers and the community level centers. So in these centers, only one ophthalmic assistance will be posted and one ophthal will be posted. Now they won't be available for all the days in a week. They will be available only in 2 days or 1 day in a week for that community level. They won't be posted in all the days, or they won't be available in all the days. So if any condition is noted, they will refer to the secondary centers. So secondary centers is something like which includes government GH or the taluk level government hospital. So there you will have a ophthalmologist which will be where they will be available for all the week in a day. And only few centers will perform cataract surgery. They won't perform all the surgery, only cataract surgery will be performed. If that is very complicated, they will refer them to the tertiary center. So tertiary center is something like which the government hospital is there along with the medical college. So that is the tertiary center. There they will perform only the cataract surgery. If you want some super specialty kind of treatment, in the sense oculoplasty or retinal procedures, we have to refer them to the super specialty center. For example, in Tamil Nadu, we have Regional Institute of Ophthalmology, which is placed in Egmore. So there they will do all the surgery at the free of cost. So this is how the distribution happened in government sector. When you apply the same distribution to the private sector, again, you just imagine a pyramid that is subdivided into 4 boxes. So down will be the vision centers. So vision centers, a vision technician will be posted in the vision centers. So if the patient comes, they will do all the preliminary workup. And teleophthalmology, here the teleophthalmology plays a big impact and a big role in diagnosing the cases. So posted ophthal will look a patient through a big screen, and they will diagnose the patient with any conditions. If anything is needed, they will refer to the nearby secondary center of their institute. So they will go to the second centers. Again, the same case. So the secondary center will do all the cataract surgery, but they won't perform any retinal surgeries. But the retinal injection will be given, but the retinal surgeries won't be performed. So if any retinal surgery is needed, they will send them to the tertiary center. So tertiary center is something like you will have all the specialty OPD, all the specialty ophthalmologists, all the surgeries will be performed over there. OPDs like cornea OPD, refractive OPD, oculoplasty OPD, everything will be there. So the patient will be referred to the tertiary center. And same like super specialty center, in the private sector also, there is a center called Center of Excellence. So there it is similar to the tertiary center, where they will have all the specialization, all the subspecialty center. But apart from that, they will give a big importance to the research and innovation. For example, they will have a separate center for the microbiology, pathology, and they will do a stem cell research, and they will do a big kind of AI related research, everything they will do. So this is how the levels of prevention is distributed among government and the private sector. Also, she had given a hint on activities on National Program of Control Blindness. Yes, it's playing a very good role and a huge role in the control of preventable blindness. And there are also some programs which is concentrated on the state government, but it also varies depending on the state wise, where an optometrist should ideally know what are the programs that running in the state wise basis. So for example, national wise, if you see National Program of Control of Blindness and Ayushman Bharat. Ayushman Bharat, you might have heard that a name, which is which you can see in most of the places. It is again a free insurance, which it will cover 5 lakhs per family per year. It also includes eye surgeries. Patients can go and treat their eyes even in the secondary and the tertiary center. And upcoming, these are some of the state concentrated program, which is Tamil Nadu State Blindness Control Program. So they are also concentrated only on the cataract surgery. In this case, the patient is given amount of 2,000. 2,000 is allocated for per operation. The patient have underwent to any government or private or NGO organization. So these are something like related to surgeries, and these are other schemes which is related to spectacles. So in Tamil Nadu, there is a scheme called Kannoli Kappom. So in this, under the scheme, a free specs was given to the students who are between the age of 6 to 12 years. But for this, a student should be studied in the government institute. If a student is studying in the private institute, he can't able to come into the scheme. As for this, a student should study in the government school. And the next scheme is the Varmon Kappom Thittam. So this has been implemented, but it haven't started it. So where only the reading glasses is given to the patient above 40 years. But for all of the scheme, the eligible criteria should be a patient should have Chief Minister Comprehensive Health Insurance Scheme to cover all the scheme. And the next thing is, she also mentioned about Vision 2020. So there she had mentioned that, but target in aging global population was not reached. There is a reduction in avoidable blindness in that age group. She had mentioned that nicely. So if you look into it, when you go to the older groups, that is the oldest group above the age of 65 years, there are about 45% of them have a blindness and the visual impairment. This is a survey according to NPCB survey. So in India, if you take the overall population, so 80% of our population is above 60 years. But the researchers has estimated by the year of 2050, it will be around 20%. So still there is a lacune or there is a steady gap. And so the researchers and the upcoming scientists are looking into the more focused on this geriatric kind of population. So these are my few comments and suggestions from my side, Mahathi. We can pick up the questions if needed. Thank you.
Thank you so much, Mr. Raghu. To conduct the Q&A session, now I welcome Ms. Meenakshi.
Sure.
Ms. Meenakshi, please go ahead.
Hi, Guru.
Hi, Meenakshi.
Okay, getting into Q&A, we'll start with the YouTube questions. Meanwhile, if the participants are having any doubts or clarifications, please do post it in the chat box. The first question is the difference between clinical approach and the community approach.
Yeah, good question. So clinical approach is something like you will first, you have to focus. The focus will be in the clinical approach. You will approach patient on an individual basis. But in a community basis, you will approach a patient on a group basis. So the focus area is something like individual basis, and here it is a group basis. And the next thing is setting. So setting in the sense practitioner, how the institute is set up, or how the clinics is set up. So in clinics, you can see you will have all the investigations. You will have slit lamp, you will have OCT, you will have A scan, you will have everything. But in camp, it is quite difficult, right? We will have only few things. So we can able to appreciate with that instrument, we can't able to go deep with their findings. So we will have only few things in that area. And the next thing is the scope. So coming to scope, in clinic wise, you will give treatment to the patient. In camp wise, mostly you will give referral or kind of rehabilitating kind of setup you will give for the patient for the patients who are coming to the community setups.
Thanks, Raghu. The next question. After the community approach, what has to be done?
Okay. After the community approach, so for example, you will find that this area have a highest burden of cataract or something like pterygium. So the next thing is, if it is like something like related to like surgery opinion, you will fix and you will refer the patient, or you will make an arrangement for the patient for a surgery. If that is not the case, if it is something related to visual impairment or something else, the next thing is you can write a proposal to the funding agency, and they will allot a funding to us. And with that funding, we can able to appreciate the patient who are into a visual impairment, and we can give them a spectacle corrected lenses. So this is how it is different.
Next question is how to start a community approach.
So first and the foremost thing is your area of interest. So whichever area of interest you have, so that is the main thing you have to set up in that area. And the next thing is in community, for example, you are setting up in a community means you have to know at least 60° of that community setup. What is there, how many, for example, gender distribution, what is the population size in that area. You have to know all those things. And after knowing all those things, you have to dive into it.
And how many people do we need to carry out a community research?
It is a kind of like there is not a estimated population. Like for example, in a vision center, if there is some guideline to construct a vision centers, secondary centers, tertiary centers. But for example, in a community level based setup, there is no specific guideline like with this much only we should go for community, or with this much population we should start up community. If there is any kind of global burden of eye health or eye health disorders, you can approach the team and you can pull out the cases. So there is no any standard guideline for that.
Okay, moving on to the next one. As a public health optometrist, how can we use teleoptometry?
Yeah, as I mentioned, right? Like this will be, as an optometrist, this will be useful in the kind of PHC or in a vision centers. So there will be so many cases where as an optometrist, we will have a doubt to prescribe the medicine, or whether it is a true or false. We will have a doubt in that. So in that case, the telemedicine will play a huge role. We will contact a like Oftal. So they will check it once, and they will give us an opinion what to be done further or what not to be done. It will be useful for the patient in many ways.
Thank
And
you.
the community.
Next one is Guru. Thank you. How is IEC practiced?
IEC practice is something like whichever work we are doing, we should write that in a paper and publish that to a community, so that the people will educate themselves. This is not only the people for the community basis, also the people who are into the for example, a vision technician or a optometrist or a ophthalmologist. They should also know whatever is going on, whatever is lag, and still there is a research gap in which area we should concentrate. So all this comes under a one subdivision, which is something like writing a paper and publishing it. So once we start doing that, people will get to learn about that things by reading our work or by reading what is there in the community side. So this will comes under all those three criteria.
Thanks, Raghu. The next one is how to take up research with public health.
again, like first and the foremost thing is you should be very clear with the objective, whatever objective that you, the topic or the objective that you are interested in. And the next thing is, if you are doing a study, how it will be helpful for the people who are reading that, or people which are the people who will be get benefited from that. So you should see in that aspects. So before doing that, we have to do so much review of literature, and we should find a research gap with our research interest, and we should fix with some topic. And after framing all this, we can go with the study.
Next one is the importance of communication in eye care services.
Sorry, can I?
Sure.
Hello?
I repeat.
Yeah.
Hello.
Yeah.
Am I audible?
Yes, Meenakshi, you are.
Communication in eye care programs.
Hello.
Hello.
Yeah, Meenakshi,
Group.
am I audible?
I repeat the question.
Yes, please.
Importance of communication in eye care programs.
So the first and the foremost thing is advertising. So wherever the camps is there, we have to advertise in their locality, at least of people surrounding to a vision center or a something like secondary centers, 10 kilometers to that surrounding. People should be aware of that a camp is going on. So the people will come to us and they will check their eyes, which will be mutually benefited for both the sides. This will be applicable especially in the people in the remote tribal areas or the rural location. So advertising is the main area where the people can able to get that.
The next one is a person asked about to elaborate on conjunctivitis because it has given a rise again, and why do we see the rise again in conjunctivitis?
Yeah, this is something like not only conjunctivitis. As a public health, we also want to correlate the clinical conditions with the geographical histories. For example, in 2020, we have got what is that locust, kind of caterpillar, which has been came from other country to the Rajasthan. If that case happens, we have to rule out whether there is a sudden increased case of ophthalmia nodosa, where the ophthalmia nodosa will happen due to the hair in the caterpillar hair. So like that, conjunctivitis too, it become epidemic because like cases were quite high in last 2 months. It had concentrated on especially the metropolitan cities, for example, like Delhi, Rajasthan, Hyderabad, Mumbai, Chennai. So the cases were very high. This one of the main factor can be a rainfall. So because of the rainfall too, this is something like what to say, confounding factor. So we can't say like because of this is something like a confounding factor.
The last question is recent advancement in public health optometry.
I would say for this research. So in the sense, how much you are, as an optometry students, how much you are concentrated on the research, you will bring a innovation that will be helpful for the people in the, especially in the rural areas and the rural based community population. So research is the only way to look further, to bring innovation to them.
Thank you so much, Raghu. Anshi ma'am, would you like to ask any questions, ma'am?
I think that was a very in-depth question and answer session, and I was very happy that we had so many questions today. And Raghu, I think you've done a fantastic job. So I would just like to overall summarize what Raghu would have, and Gomati has tried to, the student, sorry, Gopika has tried to, convey to us that public health and optometry can actually go hand in hand rather than keeping it as separate topics. We have to really think about community based service. We have to think about reaching of eye care services not only to the urban areas, but also to the rural areas, and the various approaches which have been discussed, and how people can know about all this through IEC or through further research. So that was very well brought about by Raghu. So I would say that's one of the very nice series that we've had today. Thank you, Raghu, so much for your time and so much of information that you shared with us.
Thank you, ma'am. Thank you so much.
Over to you, Gomati.
Thank you so much, Anshi ma'am, and thank you so much, Meenakshi and Mr. Raghu. That was a wonderful and detailed explanation. Thank you so much for joining us and accepting our invitation. Thank you.
Thank you so much, Gomati. It's my, what to say, it's my pleasure. Ma'am had called me, so it's my pleasure in attending this.
Thank you.
Thank you.
Dear audiences, thank you so much for your continued support towards the Optometry series. If you like this video, give a thumbs up and share with your friends. To know more about the happenings at Dr. Agarwal's Institute of Optometry, do follow our Instagram, Facebook, and LinkedIn page. The links for those will be given in the description box. If you like this video, give a thumbs up. We'll meet you in the next episode. Thank you all so much.